Hi friends, this is Dr. Shadab. I welcome all of you to my YouTube channel, Health Knowledge channel. Today we are going to discuss a disease which we call high cholesterol. First of all, we would try to know what is high cholesterol and what are its signs and symptoms, and then I'll tell you how you can decrease the level of high lipid. Actually, first of all, I should tell you that in our blood there are many things are there in our blood, like lipids are also there, plasma, RBC, WBC, these are. And high cholesterol is a condition where the cholesterol is in high amount in your blood. And how it happens, how it is increased. So let's talk about it. Actually, we have cholesterol in our bloodstream so that the blood may flow smoothly. But when the number of this cholesterol is higher than the normal, it is called as high cholesterol. The normal range is 150 to 200. 200 is the best one, the number of cholesterol, and above 200, like 230, 240, or 330, or 300, or more than. So there are many high chances that the person may feel he is prone to many disease which are really dangerous. So let's discuss cholesterol, why it is formed. Actually, the cholesterol we receive from non-veg, like we eat chicken, or we eat buffalo beef. So cholesterol, when the body is not able to absorb this kind of fat, so it becomes more in our bloodstream. Like we are taking non-veg food, like we are eating flesh or meat, like we are taking, but we are not working out. We are not, our lifestyle is very sedentary. We rarely exercise, we rarely work out, we don't go for a walk usually. So the number of lipid, like we have LDL, HDL, and VLDL. LDL it's the low density lipoprotein. This is very bad for a human body. Another one is HDL. This is high density lipoprotein, which is very good for a good healthy life. And another one, the worst, is VLL, very low density lipoprotein, like cream. So this is which floats on the blood. We take VLDL. So let's talk how we can curb it, and what are the signs and symptoms of high cholesterol. When we get a fat from a non-vegetarian source like meat, so it is cholesterol. And when we get the fat from the vegetarian food plants, it is called as triglyceride. So both are important, but when these lipids are higher than the normal, so they create very severe problems like hypertension is also a cause. The high cholesterol, and the person who is having more cholesterol in his body, he'll be idle, he'll be obese, his waistline will be greater than the normal, and he's not doing any work, he's not exercising, he's not working out in gym or anywhere, he does not go for a walk. So the level of these kind of triglycerides and cholesterol gets increased. And the symptoms the person may feel, as I told you, that hypertension, high blood pressure, dizziness, and dyspepsia is also it is also possible that the person will be having indigestion or dyspepsia, where the food is not digested properly, and he'll be having some burning sensation in his esophagus or in his chest, and many people have the angina pectoris. Then when the oxygenated blood is not it's not proper amount going towards the heart muscle, when the proper blood is not able, there is some obstruction, so we call it angina, and the patient has a feeling of pain, tightness, like his heart is clutched, or he feels pain in the chest region, or in arm, or on the shoulder or jaw. Here also people on the left side of the body, and in the back of the heart, the people also feel pain, some squeezing pain, tingling pain, and sometimes the back of the heart, the region is numb. He does not, or he or she does not feel anything, like this is numb. And these symptoms, what a person is feeling to his left side may feel towards right. So this is also, it is also possible that a person who is having a high cholesterol in his blood, so he will also have this kind of things. Now let's come to the treatment. Actually, first of all, we have to change. This is the disease of lifestyle, because our body is not, God has not created our body to be sitting idle, not doing anything. Our body is it's the way that if we use it, if we take the use of our body, it's good, it is long lasting when we use our body. And when we are sitting idle, we are taking rest all the time, we are taking cold drinks, junk food, blah blah blah, these bad foods which are very high in cholesterol and triglycerides. So our body gets unhealthy, and we get the victim of these so-called diseases. So first of all, we have to make changes in our lifestyle. We should, everyone should start exercise around 30 minutes 3 days in a week. He should go, or he or she should go for a walk, or brisk walking, or swimming, cycling, running, jogging. There are a lot of exercises a person want to do, or you can join gym. And you need to avoid something, really. You have to avoid white sugar, white salt, and you can take rock salt, you can take that. And also if someone is suffering from high triglyceride or high cholesterol, so he is prone to have coronary artery disease, and myocardial infarction, which is called as heart attack or stroke. Because when there is much cholesterol in our arteries, so the the path or the way of blood gets obstructed, and the blood is not able to pass this plaque. So when the oxygenated blood is not able to pass through the arteries, so heart muscle does not get the proper oxygen, proper blood, so the cells started dying, or it the the arteries gets blocked, and heart attack takes place. It's really, this is the number one, uh, you can say, number one disease where in every country people are dying because they do not take care of they do not go to the doctors, they do not get their lipid profile checked. So everyone should visit doctor, whether he or she is good or fine. After every 6 months we should go for checkups, we should go for our lipid profile checkup. Only then we can get to know what is going on into our system, into our body. And we have to avoid spicy food as a whole, oily foods, whatever people say that you can take mustard oil, someone says sunflower oil, sundraw, blah blah blah. Every oil is your enemy if you're having this problem. Cut down on salt, cut down on meat, buffalo beef, mutton. You can take chicken or fish once or twice a week, and regular exercise. Also, go for regular checkups after 6 months about it. And when the level of triglycerides and cholesterol is high, people have palpitations, and they feel their whole body is pulsating, they can feel the pulse in their whole body. And when they go to the doctor checks you up, but he does not find anything until and unless you go for the lipid profile test. So this is a humble request for everyone. If you are feeling palpitation, if you are feeling anxiety, dizziness, or feeling like that, or you have headache, your vertigo, so, and you're obese, you should go to doctor to check your lipid profile up. And along with this, you can do yoga, some exercise, because our lifestyle has been such that we don't exercise. And this is only the reason that our body gets infected with these types of things. Now let's come to the homeopathic medicines. And so before homeopathic medicine, I would like to say to you, if you can take garlic, raw garlic, 2 cloves in the morning on empty stomach. If you take it, so your triglycerides and cholesterol levels will be normal within a very short period of time. If you cannot take it, so I'll tell you, there are 2 medicines in homeopathy which are really superior to any other medicine, which help you in lowering your bad cholesterol and enhancing or increasing your HDL, good cholesterol. The first medicine is Allium sativum. Allium sativum mother tincture. It is the remedy made from garlic itself. And get Allium sativum mother tincture from homeopathy medical store, and you need to take this medicine. You need to take 10 drops in a half cup of water thrice a day. So you need to take it for a couple of months, and you need to go to doctor to check your lipid profile up every regularly. You should go, and you will see it has the best results. Another medicine is cholesterinium. As the name suggests, cholesterinium. So cholesterinium 3x, you need to take this medicine, and this medicine is really good in curbing your high triglycerides and cholesterol. You need to take two tablets. There are tablets in the file. Take two tablets in the morning, and two tablets in the evening, and carry on, keep it up, keep it taking for another couple of months, and